According to the latest report from the South African COVID-19 Modelling Consortium, scientists, hospital admissions and deaths during South Africa's expected fourth wave of COVID-19 infections are projected to be considerably smaller than those of previous waves. We will get more details on this now from Professor Ramneek Ahluwalia, CEO of Higher Health. He joins us now live. Professor, thank you very much indeed for your time. I just want to go through the numbers with our audience as well. So if you could just follow us with regards to the latest COVID-19 numbers. This is what we have so far. 887. This is according to the National Institute for Communicable Diseases. Active cases stands at 18,000, over 18,000, and as you know, 2.9 million total cases. New deaths. This is what we need to always remember in terms of it can't be, these numbers can't be abstract, isn't it? Because people have lost, people are still mourning those that they have lost. So it's important to remember those that have gone due to COVID-19. Total deaths, 89,572. Now, this is something that we need to always pay attention to as well. The positivity rate, 2.8%. Why? Let's bring in the good professor, help us understand this. Professor, when you look at the numbers and projections and the modeling, what's your take with regards to where we're heading in the expected fourth wave?
So thanks, Blaine. Good morning to everyone. Blaine, we're going to be looking at three key variables that will define our fourth wave. So the reality is that the fourth wave is inevitable. We're going to have a fourth wave. And I think if you had asked me this question last year, we probably did not know at the same time much about this virus. We're trying to decode this virus, we're trying to understand. But now, with the inventive science, and we've learned this virus so well, that we can actually now start predicting the virus. So which means we can start predicting what's going to be in the next 2 weeks, what's going to be in the next 2 months. And I think that's what the Modeling Consortium has done by putting all the data sets together and understanding. So there are three key variables that's going to define our fourth wave. The first one is behavior, human behavior in general. We're going to go into Christmas, and you can clearly see you've been reporting 200 cases a day, and now it's moving to 882. It starts giving you an inclination towards what this virus is behaving. Plus, more importantly, is the human behavior, which we obviously know in the festive season. Crowds will come in, people will mingle together. All the non-pharmacological interventions like the mask and the social distancing are going to go away. And that's going to lead to what the virus enjoys, move from one human to the other. Keeps moving, grows the viral loads in the human body, and starts increasing the transmission, and also starts moving to another body that will like to mutate. So the second variable will be mutations. What we're going to be watching now is, if you remember, the first wave was caused by the original coronavirus. Right. The second wave that happened last year in Christmas was because of the variant called a beta that was detected in South Africa. And now what we've come out last month was a brutal third wave, which actually was because of a variant called Delta. So now we're going to be watching, and we had actually been observing some variants of interest, both in South Africa and around the world. And even the Delta variant that caused us a third wave is already started mutating, and something has produced itself to call a Delta Plus, which is already showing 10 times more highly transmissible. And that's what we've seen in UK, United States, and many other countries now. Haven't seen yet in South Africa, but it's not too far away. Right. But what will happen if mutations are going to happen? And that's again the inevitable reality, because this virus will mutate, and we've clearly seen that. The question is, what will be the new variant of concern that we're going to be seeing causing us the fourth wave? Will it even have escape mutations? We clearly know that when you get, so 60 to 70% South Africans already have something called natural immunity, because they already have been infected with COVID-19. Some of them died, some of them had symptomatic infections, some of them had asymptomatic infections. So that immunity is weaning off, and that immunity also starts waning down gradually. Right. So is the immunity. Yeah. Okay.
Look, I just want to get a sense of this number here. The positivity rate, 2.8% currently, according to the NICD. When do we need to start getting worried in terms of if this disease is getting away from us once again? When are we entering a fourth wave? Help us understand the science.
So the positivity rate is when you have people who start showing symptoms, go to the laboratory and do a test. And from the number of samples that we estimate out of for a COVID test, how many of those COVID tests start becoming positive? And if you remember how we define a fourth wave or we define a wave is that from the last wave, if we start seeing 50% and above cases becoming positive from the peak of the last wave, we start defining that we've started moving into another wave.
Right.
So the positivity, once it starts moving around 12% or above 10%, it's going to start worrying us, because then the total number of lab samples that we are taking for COVID-19 or people are reporting, more 10 to 12% of people have started becoming positive.
Right.
And that's going to worrying signs.
And we've seen this increase in terms of case numbers around the world of late. Europe, some countries in Europe are going through this resurgence of cases. Austria, if I'm not mistaken, is going to be going on a lockdown very soon. The science tells us, the scientists tells us, vaccinate. This will help put paid to the spread, or in terms of lessening the symptoms of COVID-19. Is this, though, going to be a mission not of science, but of messaging in trying to convince people to get the vaccine?
So, Blaine, if you remember, I was speaking about three variables. The first variable was the behavior, the second variable was the mutations. But the third big variable that defines our fourth wave will be the vaccination.
Right.
And how far will South Africa get vaccinated? Now, if you look at UK, and yes, we've seen the Delta variant causing havoc in Europe right now, or other parts of the Western world, and including Russia and Austria now. But the question will be is people are not dying, and people are still not being hospitalized, whereas the number of infections are high, which means the positivity rates is high, but the deaths and severity of the disease is low, and predominantly because of the high number of vaccines that have been already provided. Now, what happens with the Pfizer or the J&J that is in South Africa is that in 6 months' time, there will be a time when the immunity will start slightly waning down. It doesn't, when it wanes down, doesn't mean that you will be still hospitalized or you will have death. No, the vaccine will still hold the fort for you. But what will happen is that you will have chances of breakthrough infection, which means the infection come into your body and can still cause a little bit of viral load, slightly transmissible, but you'll have a mild to moderate infection. Yeah. That is exactly what we're seeing in Europe right now, what we're seeing in Austria, what we're seeing in those parts of the world. And the unvaccinated people in that part of the world, unfortunately, are succumbing to severity of the disease or deaths in reality. And for South Africa's fourth wave, that's going to be a defining factor. We clearly know this virus will mutate. But we do also know it might not mutate, that it may be able to break the vaccine immunity. Well, that's a wait and watch. But still, the vaccines so far, even 9 months down the line, are clearly showing absolute effectiveness against multiple variants. So that's going to be a defining factor. And South Africa can reach 70% of its population vaccinated. What's our desire? What we're aiming towards? And should we reach that level, our fourth wave number of deaths, number of severity will be so low that we might not need those severe lockdowns like lockdown 5 and end up in a lockdown 3 of a fourth wave, which will help in business continuity, economy, and less number of deaths and survival.
What would you say to those who say, look, it's my choice. I'm willing to take the risk. I'm not going to get vaccinated. Some would argue that you have a right to do something. Doesn't always mean that it's the right way to do it, isn't it? Taking a risk. It's not only a decision you make just for yourself. You're making that decision for others who might not want to take that risk. How do you convince somebody that is totally opposed to taking the vaccine?
I want to inform them that if you are not vaccinated, you have 11 times more chances to die compared to anyone around you who's vaccinated. If you're not vaccinated, you have 29 times more chances to be hospitalized or in the ICU, which is not a good feeling to be in, and still can debilitate you if you are compared to somebody who's vaccinated. So the choice is yours. This is the most safest vaccine the world has ever seen. Science has really done a tremendous job in this regard. We cracked down this virus. The vaccine provides you with an immunity which is far more stronger than your natural immunity. So what will happen is the virus will come in, your vaccine immunity will allow your immune cells to generate so fast that it will take over the viral load of the virus and reduce the virus, which will help you fight the infection stronger. We can't stop moving from one human to the other, but the vaccine will block it.
I always say messaging is so important. And sometimes over this period of this pandemic, there seems to be some mixed messaging, worldwide I'm talking about. And I guess it's okay for a scientist to change a position based on a change in fact. People aren't used to that because sometimes, let's say in politics, a position is held until you can't hold it anymore. How should government approach the messaging aspect?
I think so far the government has done a great job, according to my understanding. They have brought the scientific world first. They've brought the science first, which is the right way to approach. There will always be the anti-vaxxers or people who do not believe in vaccines. We need to learn to respect them. But the question is, we need to have a discussion with them. We have to genuinely understand people's concerns. When I go from one community to the other, and specifically when I go into varsities and meeting young people, they have genuine questions. Will I not be able to reproduce further? Will my testicles be enlarged? The question is, you speak to them, explaining them of a 3 billion people data of vaccines so far and telling them that the world is still reproducing. There is absolutely very minimal number. You're absolutely right, Blaine. We have to be honest with our people. We're living in unpredictable times. The virus is more clever than us. It starts mutating to more than a scientist can understand. But what we have currently with the vaccine and the way it's shown its response against multiple variants so far that the virus is being produced is something that the world that South Africa needs to know. Media plays a huge role, and you play a huge role for us to communicate to everybody at home, to make them understand about this virus, make them understand how this vaccine actually protects you from this virus or this mutating virus, what's the science behind it, and all these myths that come on around it, how we can tackle them one by one so that people understand that the world is safe with these vaccines.
Look, we've been saying it for the longest of time, at least here on the agenda. Surrender the me to the we. It's about how we interact with each other, isn't it? But the question still remains. I'm not sure in terms of higher health, how students, learners are tackling this issue. How do you muster up and maintain courage in a crisis?
I mean, we have no choice here. We've got an enemy which is invisible. We cannot lose our guard. It's been 1.5 years of intense work, and it has to continue, because once we lose our guard, the virus overpowers us, and that's the world we're living in, which means human behavior, engaging the communities, continuous education, building systems, building protocols, right from a security guard, because he plays a very significant role ensuring whether you're in offices, whether you're in campuses, people are entering into it, they are screened on COVID-19, right to a cleaner, because we also know the surfaces play a very important role in the spread of the virus. We also know ventilation, speaking to the management, because this is an airborne disease at the end of the day. It spreads through aerosols, and we need to have a proper ventilation around us. So these kind of continuous capacity building engagements becomes a defining factor. And as you know, this virus mutates. This virus has formed a human to human. It's currently come into a human settlement kind of a thing. One cannot lower its guards down, and that is why speaking to the public is absolutely important and critical at this moment, is educating them on every element and every new science that we understand that this virus needs to be spoken and needs to be clarified to the public.
No doubt our strength really needs to be a function of our respect for one another. Prof. Ramneek Ahluwalia, CEO of Higher Health, we thank you very much indeed for your perspective. Be well. God bless.